This slide series is done in memory of Dr. Edward Ross Ritvo, who passed away in June of 2020 at the age of 90 years. A pioneer in autism research, he led the field in establishing that autism was neurobiologically based. A graduate of Harvard and a U.S. Army veteran, he spent his entire academic professional career at UCLA. His work included studies of diagnosis and classification, genetics and epidemiology, as well as neurobiology and psychopharmacology. He trained generations of leaders in the field and is survived by family members and many, many students. It's an honor to dedicate this series of talks to his memory with the support of Dr. Ariella Riva Ritvo Slifka and the Alan B. Slifka Foundation.
Welcome to the Professional Educator Training Series, a video series from the Center of Excellence on Autism Spectrum Disorders at Southern Connecticut State University. I'm Carrie Sassu, the Director of Strategic Initiatives at the Center and a professor in the Department of Counseling and School Psychology. Today's talk is about executive functioning, and the objectives for this video are to explain the underlying aspects of autism spectrum disorder and executive function that may cause challenges in the classroom, to identify effective strategies for addressing commonly encountered classroom challenges for those with ASD, and to establish connections between identified challenges and classroom strategies likely to relieve those challenges. And providing this information to you such that you can do these things at the end. What is executive functioning? Simply put, executive function is a set of skills that allows us to engage in the actions of initiating, planning, organizing, and self-regulating. Russell Barkley's definition is actions we perform to ourselves and direct at ourselves to accomplish self-control, goal-directed behavior, and the maximization of future outcomes. So these are high-level cognitive functions that help us to determine to what we should devote our attention, help us to organize and plan our actions so that we can work efficiently, and they also help us to manage our emotions. Let's talk a little about the relevance of executive function as it relates to students with ASD in schools. It's important to highlight two key points here. First, skills related to executive functioning are required for school success. Things like planning, organizing, managing one's time, self-monitoring, initiating tasks, sustaining our attention even if the task is boring or uninteresting, these are all involved in daily school and social activities. And the second point is, executive function deficits are common among individuals with ASD. Common elements of the complex presentation of individuals with autism spectrum disorders include challenges with communication, social reciprocity, and restricted and/or repetitive behavior. Involved in all of these things, really at the heart of these challenges, is difficulty with executive function. Let's explore this by looking at what are some common challenges among those with ASD. Do any of the students with ASD with whom you work have difficulty engaging in new tasks, selecting and prioritizing how to move through an assignment, identifying important information from that which is less important or irrelevant? Do they struggle to develop a plan and execute that plan efficiently? When a problem occurs, are they challenged by an inability to develop efficient strategies for solving that problem? Some students with ASD may struggle to initiate an activity, become upset when they need to stop that activity, or have difficulty shifting to a different activity. Other common challenges include difficulties engaging in self-monitoring, meaning keeping track of one's own behavior, thoughts, and actions. Individuals with ASD can often be literal in their interpretation, causing miscommunications or behavioral missteps. And flexibility may be a struggle, not just as it relates to behavior. For many, routine and sameness may be preferable, but also being flexible in terms of flexible thinking. Of course, this is not an exhaustive list nor a universal truth. Every one of these doesn't apply to all people with autism spectrum disorders. The degrees to which any individual with ASD is challenged by any of these varies. This is merely a place for us to start to identify some common challenges and link those to practical interventions. As was noted earlier, executive functioning is comprised of a myriad of skills. Let's explore some of the more discrete skills involved in executive functioning. One is planning. This is the ability to create a cognitive map or a set of steps in order to reach a goal. Problems with this might look like an inability to determine what are the necessary steps to complete an assignment and prioritize the order of those steps. Linking that to the skill of organization. Organizing involves the ability to establish and maintain methods or systems that help us to keep track of information or materials necessary for the completion of tasks. Students might have materials from different assignments all piled together. They may lose track of materials or fail to take note of when things are due. Time management refers to one's ability to gauge how much time one has, how to make the best use of that time, and work efficiently. You can see how planning, organizing, and time management are intertwined in many school tasks. Working memory refers to the ability to hold information in one's memory while performing complex tasks. So difficulties with this may manifest as students who forget the directions or steps in a series of directions, or who struggle to complete certain mental tasks like solving math problems in one's head. Metacognition is really thinking about your own thinking or actions. It's an awareness of one's own cognitions, the ability to evaluate your own behaviors and thoughts. Think back to the difficulties with self-monitoring noted earlier. Other elements of executive functioning that are necessary for both academic and social success are things like response inhibition. This is the capacity to think before we act. Difficulties with this might look like talking out in class without waiting to be called upon, or interrupting others in a conversation. Emotional control refers to one's ability to manage emotions and direct our behavior in order to achieve a goal or to complete a task. Some who have difficulty with emotional control can become overly frustrated with small mistakes and focus on those, whereby preventing them from moving forward with the rest of the task. Sustained attention is the ability to maintain one's attention to a situation or to a task despite other factors such as distractibility or disinterest. Difficulties with this might be that a student stops before they complete a task. Task initiation is the ability to begin a task without procrastinating or requiring excessive prompting. Students who struggle with this often need cues to begin work or to persist in their efforts. Flexibility here refers to the ability to revise one's plans or a strategy when they encounter a setback or when they receive new information. So those who have difficulty with flexibility might get stuck on one way of doing things or become upset by changes to plans in their schedule or their routine. Persistence toward a goal. Once you've established a goal, this refers to the ability to follow through until the completion of that goal without being distracted by competing interests. A student who struggles with this might lack follow-through and have difficulty making the connections between daily practice of an activity and the mastering of that skill. In individuals with autism spectrum disorder, we commonly find that they have difficulties with organization and planning in the cognitive regulation domain, along with challenges in behavioral regulation. They may not be able to inhibit impulses, and given challenges related to flexibility, they may struggle with emotional regulation. And all of these challenges have implications in multiple arenas. So we're not just talking about common problems with academic tasks, but also other demands within the school setting that are not strictly academic in nature. Hopefully, you're able to see how underdeveloped skills in these areas have implications for social situations as well as activities of daily living. Those being things we do each day to take care of ourselves, such as grooming or eating or dressing or even toileting. Highlighting some more specific examples of how this might impact academic success. Let's start with writing assignments. These can be difficult because they involve planning, organizing, metacognition, and sustained attention. Math assignments can involve all of those skills as well as working memory. Long-term projects may involve all of those skills and also time management and goal-directed persistence. Reading comprehension. Among the skills involved in reading comprehension are the abilities to extract salient information and decipher what is literal from that which is figurative, so it involves interpretation. Organization of one's space and things requires those executive functioning skills of planning and organizing. In terms of routines and daily expectations, if something changes, it often challenges the flexibility component of executive function. And when it comes to social interactions, difficulties transitioning between activities or topics, as well as tendencies to perseverate, are related to executive function and often make social interactions difficult. So what can we do? First, familiarize yourself with what are the scientifically based strategies that have proven effective in addressing these challenges for students with autism. In this ever-evolving field, we must all remain committed to continuous education and the expansion of our own skills. The field of autism has changed dramatically, and research continues to proliferate. We have to continuously engage with it to ensure that we are current and aware. We must also be critical consumers of that research, not just adopting what is new, but testing our own approaches. Even when we try a strategy that we expect will work to address our students' needs, we must hold ourselves accountable to collect the data that will allow us to reflect on our practices and, if necessary, make changes to them. So we have to commit to evaluating our practices too. This means setting up a system for data collection, and not just collection, but analysis too. Taking a careful look at the data so that we can use them to inform changes to a program. How do we know if something is working if we don't have data to prove it? By that same token, how do we know it's not working if we don't have the data? If something isn't working, if the selected strategies are not working, it's likely that there may be something that needs adjusting with the plan. Try to refrain from blaming the child. It could be that the implementation of the intervention is not working, the collection of the data, or perhaps the strategy selected is just not a good fit for this particular student. But to attribute the reason for something not working to the child with an autism spectrum disorder just doesn't make sense. We don't fit the child to the intervention. We find the intervention that fits the child. In all likelihood, the child is doing the best they can with the skills they have, just as we all do. Which leads me to the next point. We may have many years under our belts and advanced degrees. We may have met with great success working with children over the years and still be challenged by a student whom we encounter. This is not a failure. It's an opportunity for us to learn something new. We can engage with other members of the team who have different training, different understandings, and expand our own. We can look to other professionals on our team and the families or caregivers to inform our collective efforts to advance the skills of the child. All of us come to the table with extensive training in various fields, and when it comes to families, they have insights that we don't. Let's do our best to capitalize on that. Effective transdisciplinary teaming is critical when addressing the needs of students with autism spectrum disorders because their needs are often complex. Here, I'll refer you to another of our videos in which we discuss the topic of collaborative teaming. So let's look at some proactive strategies to address executive function. Many of these are things that you are likely to be already aware of, if not already practicing. But I list them here because sometimes in our day-to-day efforts, we lose track of the simplest things. And sometimes we make things excessively complex for ourselves, as well as the children with whom we work. So as you look at these, I ask you to think about a particular child with whom you work, and if you are using these proactive strategies that might help to set the stage for success. Are there any that you're missing? Are there ways that you can help families to establish these within their home as well? Certainly, setting up a workspace that has limited distractions and is conducive to work completion is important. The use of visuals often is incredibly important, not just for students with autism spectrum disorders, but for many of us. Most of us also benefit from the visual organization of a task, like a PowerPoint when someone is lecturing. Many of you might use a planner, whether a paper format or on your phone or computer. These visuals are helpful to you in terms of organizing your thoughts and your activities. And in some cases, you've set audible reminders on your electronic calendar to remind you of upcoming events. We might do the same thing for our students. Keeping the child engaged. This involves not only making things interesting, perhaps by employing things related to the child's special interest, but also asking the child to engage in a task for what is a reasonable amount of time for him or her. Also, using the PREMAC principle, sort of the first then principle, the less preferred task before the preferred activity, is a good strategy. Empowering, not enabling. Sometimes, in the interest of helping, we create dependency or enable less desirable behaviors. Here's an example. When a teacher says, "I know that assignment was due 2 weeks ago, but I'm so confident that when he turns it in, it's going to be fantastic," we're not necessarily setting up realistic expectations for what the real world allows. This is not to say that we shouldn't be flexible or accommodating, but rather that we should seek to put supports in place that will help the student to meet the set goals. Accommodate before you modify, so support first. And while you do this, establish goals and objectives that seek to cultivate executive functioning skills within the student. Overall, set expectations that convey that the child will be successful given the right supports. Other simple strategies and tools that can help us to effectively address executive functioning challenges include setting up schedules or routines. We know that for individuals with executive functioning difficulties, the emotional component often relates to difficulties with flexibility. So having a predictable schedule, knowing the routine, is important. Within that, allowing for breaks to prevent individuals from becoming overwhelmed is important. We need to build in breaks, plan ahead for breaks, and I'll talk about this in a minute. Graphic organizers, guides, maps, these are all usually helpful because of the stronger visual perceptual skills that many individuals with autism spectrum disorder have. Also, it imposes a way by which to begin to build some self-monitoring strategies. If there are 4 things on a list and the student needs to complete them in a sequential order, they can look at it frequently and guide their own actions. We could also allow choice in this. All of these things need to be done, but it doesn't necessarily matter in what order you get them done. There are many ways that organizers can be created, but a very simple and versatile one is with a whiteboard. Whiteboards are a simple and efficient way to create visuals throughout the day, and they allow us some flexibility too. If a typical schedule is changed one day, we don't have to recreate the laminated visual, for example. We can simply erase and rearrange as necessary. If a schedule goes awry, we can easily alter the plan and present it. Setting clear expectations is important. Only give a couple or a few steps at once. If I give 7-step directions, most folks are going to be overwhelmed by the amount in front of them. Presenting only a couple or a few steps at once, identifying what the goal is, and following through with a reward are all important. Next, model, coach, and support. Not just for those with autism spectrum disorder, but most of us benefit from receiving information in different forms, particularly when we're learning something new. So don't just tell me how to do it, but also show me, and then guide me as I'm allowed to experience it myself. Think about learning to ride a bike. You can tell me how to do it. Showing me how to do it is probably going to give me a better idea of how it's done, but allowing me to try it after that and supporting me to do it is probably going to be the best way of all. Let's get back to schedules and routines. Schedules are important as they help to address the difficulties with ambiguity and flexibility. And a point that I mentioned earlier, but we'll explore more here, is the importance of building breaks into schedules. Breaks are necessary and they're different from rewards. This is a very important distinction to make and one that's often confused. We need to be sure to build in breaks into our students' schedules. We know that for various reasons, be they sensory or issues related to sustained attention, difficulty with self-monitoring, difficulties with shifting from one task to another task, there's a high risk for overload in individuals with autism spectrum disorder, which may lead to behavioral challenges or disengagement. The intention of building in breaks is so that we stay ahead of the curve when it comes to overwhelming students. Again, breaks are different from rewards. Breaks should not have to be earned. Think about it this way. We all self-impose breaks in our daily activities, whether it's walking to get a cup of coffee, looking at your phone, going to talk to a coworker. We all need to shift our focus temporarily such that when we re-engage, we can put forth our full and best effort. This is especially true for individuals on the spectrum. So build in breaks for your students. Through the collection of some data, you can gauge just how much they can reasonably accomplish within a period of time and then give them a break. And this is likely to vary depending on the task. You may also be able to help families to understand what this typically looks like in school and encourage them to schedule breaks within their family activities. Sometimes we feel pressure for a student to complete something, or we want for them to push through so that we can all move on from something that is difficult or taking longer than we expected. But when a student is struggling to complete something, pushing through the task is unlikely to be the best approach. When we take the approach of let's just get this done and we can all have a break, we increase the likelihood that we might overwhelm the child, causing them to give up or engage in undesired behaviors. And ultimately, we may lose time, attention, and engagement altogether. By contrast, when we see a student is becoming frustrated or escalating, allowing for a break to prevent him or her from becoming more overwhelmed and later returning to the task is more likely to yield a better outcome. It's even better if you can observe subtle clues and predict when this might happen. We can more reasonably then build in a reward if the individual is able to take a break when it's needed, return to the task, and successfully complete it. Through this, we can also cultivate self-advocacy skills, teaching students to ask for breaks when they need them, and perhaps even refusing them when they don't. Graphic organizers, picture guides, schedules, these are all usually helpful because of the stronger visual perceptual skills that many individuals with autism spectrum disorder have. Also, they provide a way by which to build self-monitoring strategies. And if it's just a series of pictures or a list of tasks that can be done in any order, the student can then choose and erase them from the list. Related to this, sometimes even when a child can and does use language to communicate, writing it down can be a more effective strategy than simply saying it. Again, this draws upon the visual perceptual skills. If auditory processing is a challenge for your student, write it down. Sometimes reading is a lot easier to process because it's visual. Visuals also allow for the possibility of clarifying expectations. Students can see it all in front of them. Whether it's a series of steps that they can later learn to internalize and execute independently, or a schedule that allows them to anticipate when the preferred activity is upcoming and determine for themselves whether a break is necessary. When working to develop executive functioning skills in individuals with ASD, we need to explicitly teach skills that might naturally develop in other students. Breaking down these skills into steps is something I will cover in the next slide. As was noted earlier, many of us, not just individuals with autism spectrum disorder, benefit from seeing someone else do something. This may be especially important for individuals who have stronger visual processing skills. Whether we do this by modeling the actions or behaviors ourselves, use peer models, or video modeling, this is often an effective strategy. Video self-modeling can also be an effective strategy. The use of an iPad to record and play back a scripted exchange, editing of that exchange can help students to see themselves performing a task correctly, even if, in reality, it hasn't yet been mastered. For more information on video self-modeling, I'll refer you to the accompanying guidebook. We always want to look for ways to appropriately reinforce desired behaviors and reward our students' successes. Here, I'll refer you to our video on behavior reinforcement. And lastly, a note about the flexibility piece. Sometimes, as the adults in charge, we want and expect children to be flexible on our terms, but we are not always as flexible as we could be. We sometimes impose forced changes with the idea that we are, quote, teaching flexibility, but forcing too many changes at once is unlikely to result in positive adaptation. It's more likely to result in problematic behavior. For example, let's say that a child is advancing to the next grade, and as they do, we know that the child's teacher will change. The assigned paraprofessional is also changed, as may be the student's case manager. The team may frame this as an opportunity for the student with autism to increase their flexibility, but what's really happening is a lot of change at once, change that can be overwhelming. In this example, the child is transitioning to a new grade, learning a new curriculum, establishing an understanding of the new schedule, establishing an understanding of the classroom expectations, beginning to explore the teacher's behavior, meeting new classmates, and also adjusting to a new paraprofessional. This will likely result in greater difficulties transitioning, and we know that transitions and change are often challenging for those with ASD. Instead, in order to increase flexibility, we need to maintain some constants, so that when we do need to make changes, the individual has a touchstone that remains constant, something or someone that provides comfort in the face of uncomfortable change. We need to ask ourselves, what supports can we keep in place in order to aid in adapting to all of the other necessary changes? This will support the individual through the change, and then we can teach flexibility. Here's one example that someone shared with me. If we create a visual schedule with cards that we organize in a particular order, we can insert a surprise or a change card that indicates a change in the schedule is forthcoming. You could start this as fun or pleasant changes, maybe some extra swing time or extra technology time, and then introduce some neutral changes. So one subject, say science, comes before reading, but the student doesn't have a preference for one over the other. And then add in some less fun ones. Playground time is replaced by indoor recess, for example. This will increase the child's comfort with change and teach flexibility. So, going back to the idea of breaking down the associated steps of a task to teach executive functioning skills, let's go with the example of work completion. If a student is left to work through the particulars of completing assignments, be they long or short, on his own, he may meet with some success, but the likelihood that he will develop the underlying executive function skills independently is low. If, however, we teach him to break down the components of the assignment, particularly if it is a larger project such as a research assignment, we might explicitly teach how to identify the steps, prioritize these steps, estimate the time involved in each, and plan accordingly, then develop a schedule to complete the assignment. Learning these associated steps will increase the likelihood that the student will eventually be able to generalize the skill. In order to develop independence with task completion, a student needs to be taught task analysis, how to break tasks down, prioritize and order steps, and plan for completion of those steps, all the elements of executive function. In this case, we're targeting mastery of a process more than the end result. But this really is important to our students with autism spectrum disorder. Many individuals with autism spectrum disorder are taught how to complete a task through a specific list of actions and can learn to eventually execute those plans independently. What often happens when we give an instruction to individuals with deficits in executive functioning is they don't know how to begin or what specific tasks need to be completed, and therefore they may not initiate the task, or the person might hyper-focus on one element of what they interpret the directive to mean. Again, this highlights the importance of teaching a process that can be applied. And although this may first take the form of following a script, we can build on that to teach organization and planning and prioritizing. Students learn a process. If X happens, I do Y. In some cases, strong memorization skills can help individuals with ASD to learn a sequence, whereby improving their functioning. We might create a visual organization tool that allows them to respond to the following. When my teacher tells me to pack up at the end of the day, what do I need to do? The student might respond with, get ready to go home. We can then ask them, what are 3 things you will need to do in that process, and have them identify or help them to identify the 3 things they need to do. 1, get your backpack. 2, put your planner, book, and lunchbox in the backpack. 3, put on your coat. Once we've identified the specific tasks, we can then get into the planning and prioritizing part. Which should I do first? Should I put on my coat first? In this way, we teach the process associated with planning, organizing, and executing a task. The process can later be executed independently and even generalized to other tasks or assignments. It's important to remind ourselves that everyone has limitations and abilities. Individuals with autism spectrum disorder, neurotypical folks, everyone has strengths and everyone has weaknesses. So we have to ask ourselves, how can we best mitigate deficits or challenges? Can we help students with executive functioning challenges to employ their strengths to compensate for their weaknesses? And I hope, now that we've come to the end of this presentation, you see ways that we can successfully accomplish this, particularly if we embrace the idea that they just don't have the tools they need, and we commit ourselves to identifying and supplying students with the right tools and strategies. Thank you for watching this video. I hope that you took away some valuable information and strategies from this presentation. For more information, please visit our center website listed here.